Hi, everyone. I'm Dr. Jill Harkavy-Friedman. I'm the Senior Vice President of Research at the American Foundation for Suicide Prevention. I want to welcome you here today. We're going to have a great discussion. The American Foundation for Suicide Prevention partnered with the Educational Development Center, EDC, and the Suicide Prevention Resource Center, SPRC, to conduct a poll that we've been doing since 2015, every 2 years, partnering with this group since 2018. And the poll is a representative sample from the population run by the Harris poll to get an idea of what people's perceptions are about mental health and suicide prevention. And I'm very excited today to have the executive director of the Suicide Prevention Resource Center here with me, Shelby Rowe. Shelby, it's nice to see you.
It is so good to see you, Jill. And it was so exciting working with you on this project, and glad we've got this chance to talk about it.
Yeah, me too. And I want to say a little bit more about the poll. So one of the things we did this year, we asked the same questions and then we always add some new questions. So we really learned a lot. But another thing that we did this year is we doubled the sample size. In other words, we instead of studying 2,000 people, we studied 4,000 people, with an eye towards having larger groups of ethnic and racial minority groups. And then we oversampled a little bit more. We asked more people from the Indigenous American community because we really want to take a deeper dive into what's going on with that community. And I think you'll understand why once we start talking about the findings. If you have any questions, please feel free to ask them and we'll try to address them. I have some questions here that we already got from potential audience people, so we'll work our way through that, but please feel free to ask questions. Our goal today is to help people understand more about suicide and suicide prevention. What are the popular opinions and ideas about it and how we can prevent it? And also to keep that conversation going. So let's just start off a little bit with the beginning. Like, Shelby, were there any things in particular that stood out to you, or do you think the public's opinions have changed over the years?
So, one thing that I noticed that changed was that when we asked, do you see mental health, brain health, as being as important as physical health? This time we had over 90% say yes, mental health is as important as physical health, where in the past it seemed to hover around 80%. So we had a 10% increase in that. So 90% of thinking that yes, our brains are part of our bodies and our mental health is just as important as heart health, kidney health, or anything else.
That's so true, and that was very heartening, no pun intended. But the other part of that is that it seems that people still think that the system is geared more towards addressing physical health and less geared towards addressing mental health. So that's something that we can all push for. I want to just say one thing at American Foundation for Suicide Prevention. Our mission is to save lives and bring hope to those affected by suicide. But what I really want to say is that we do that by research, education, and advocacy. And the education, which is based on the research, and advocacy are things that you can do. It's really important. So when we're talking about the health system geared more towards physical health, while people think that physical and mental health are at least equally as important, if not mental health being more important, that's something that we can be advocating for so that our system starts to match what's going on with what our beliefs and our perceptions. One of the things I thought was really great is that people understand that suicide can be prevented, at least sometimes. And I want to say a word about prevention, because I used to think that prevention means it never happens. That's not what prevention means. Prevention means that you can pay attention to it and have awareness. You can try to stave off a problem, and if you have a problem, you try your best to help. That's the bottom line, to help. So it doesn't mean a never happen event. There are so many things we try to prevent, like heart disease. Well, still 550,000 people died by heart disease in the most recent statistics. So I want to shift that conversation to We want to get in there, be aware of it, get in and try to stave off any complications. And if they happen, try to help. That's our goal. Does that make sense to you?
That does. And, when you brought it up when we spoke earlier this week, well, that makes so much sense. And I think when we talk about preventing suicide, I think it's important that we all look at the same definition. And I think with that of, we're not saying, this will never happen, but we can reduce the impact. We can prevent incidents, and we can, lessen that impact.
Yeah.
I was at an event and there was someone from SAMHSA and they were talking about suicide prevention. And I love the way they kind of boiled it down to, we want to create a world where everyone wants to stay. And I think when we look at suicide prevention, that is what we're doing. And I think, with Suicide Prevention Resource Center, we are funded through the federal government, and it's our job to build capacity to implement effective suicide prevention. And so with us and with AFSP, I think it's on all of us to then create systems and communities and families that make it easy to stay.
Yeah, and also easier for people who have lost someone to suicide.
Absolutely.
So one thing about the poll, so what do people think about preventing suicide and what their role might be? Do they want to try?
So yes, and I think that's something, I remember I was actually working at AFSP when we did the first round of the polls, and that was something that was really heartening, is that consistently most Americans think that suicide can be prevented, and they want to know what they can do. They're like, I'm interested in learning. I think I jotted down, 95% said they would be interested in learning what to do if someone they knew was having thoughts of suicide. And so not only do they believe it can be prevented, most Americans want more information to know what they can do to help.
Yeah, and I think that most people, more than 90%, said that they would do something to help somebody who was either struggling with their mental health or thinking about suicide. And that's changed from over time, where people used to think, well, there's nothing you can do, or, if someone wants to do it, they really will. And that's not true at all. It's one person, one moment at a time, but there are things that we can do to help someone. So are there specific ways that the public, what do you think happened that people are thinking, understanding it more, that they want to prevent it, that they want to do something, but as you said, they don't really know what to do, but they want to learn. So how do we do that?
So I think, something that we've seen all across the country since COVID, in the last, couple of years, is there's more conversations. And so I think more Americans, more families have been exposed to conversations about mental health. And so it lets people know, wait, there might be something I can do. So they're hearing about it, they're reading about it, they're seeing it more in media, in entertainment plot lines. And so I think doing something, and one of the more effective projects that, the Ag Council and AFSP did was the Seize the Awkward campaign.
Oh yeah, I love that.
We're going to talk about what it's like to have this awkward conversation and teach you some skills on how to start that conversation. So I think that people are starting to realize it because, one, they're hearing about it more, and they're learning that, hey, I can talk to someone about this.
Yeah, I mean, and actually in the poll, more people said that they're more comfortable talking about mental health and talking about suicide than they were in the past. So it's not that, we want to have people feel comfortable talking about it, because if it's something that's hidden in secret, then people who are suffering won't talk about it because they may feel that people don't want to hear, and they're uncomfortable with it. And that's one of the things that struck me from the findings is, I want to get into some of the ethnic and racial findings. And I think, I'm so glad you're here in terms of talking about the Indigenous American population. But across other ethnic and racial groups, there was a lot of similarity in that people think it can be prevented at least sometime. They want to do something to prevent it if they can. They want to learn more if they can. They're getting more comfortable talking about it. But there were some differences for the Indigenous American population. Can you talk about that a little bit?
Yes, and as being a citizen of the Chickasaw Nation, I'm especially passionate about this, and was very excited that we were able to expand the sample size this time so that we could look at this population, itself. On that, I will say, when we look at tribal populations, even with increasing the sample size, we still have limitations just because of, we look across the general population in each state, tribal citizens make up, between 2% and 5% or less of the general population. And so we've got numbers this time. And, some of the statistics that are hard, I'll start with the heartbreaking ones and then we'll go to the encouraging ones. That 77%, which was higher than for any other racial or ethnic group, 77% said that they know someone who has been struggling, either that has lost their life to suicide or has struggled with significant thoughts. And so when we look at the overall population of who's impacted, that community definitely is reporting being impacted more. And then with 44% saying they personally have struggled with thoughts of suicide. And so of being personally touched by suicide, by mental health crises, our tribal relatives are vastly more impacted than other groups, but they were also more likely to call 988. And so of being more impacted, and I know since 988 launched in 2022, for those who may not know, 988 is a 3-digit number that you can call, and it connects you in any state in the country with trained crisis counselors, either by phone, by text. The goal is that for everyone in the nation, that they will have someone to call when they're in crisis, someone to come, be it a mobile assessment or someone to come, and then somewhere to go. And so we've done a good job in the field of making sure that our tribal relatives, our tribal neighbors and friends know that 988 is available. So yes, they have been impacted more, but they know that help is there.
So I just wanted for some perspective to say, so you said 77% of people who had been affected by suicide, by someone they know. And just so people have an idea, in the general population, it's about 61%. So most of us have been touched by either someone who's thinking about it or made an attempt or has died by suicide. So the fact that people are getting more comfortable talking about it is great, because it's not a secret. It's something that happens, touches more of us than we would like, but also that if we have these conversations, then we have better chance of people connecting when they're not feeling well. And so one of the other interesting differences between the different ethnic and racial groups was that while everybody agreed what I said before, we want to prevent it, we want to learn more, we want to do all these positive things, they were more likely to feel embarrassed or worry about what friends and family will think. And that is, some people use the word stigma. I like to think of it as negative attitudes, because stigma sounds like a column in the middle of the road, and negative attitudes, we can change negative attitudes. And I think the idea that the more we talk about it, we want people who are not feeling well to feel comfortable asking for help. But one of the things we ask people is, what do you think would be barriers to somebody who wants help but may not ask for it? And what I found really kind of, this is going to sound weird, but it's kind of heartening that the things that they thought most often would be a barrier were the person not thinking that they were going to get better, feeling hopeless, or being embarrassed. And then other primary things they felt was that maybe it costs too much, or they don't have access and they don't know where to get access. But those numbers went down, the costs and access. The reason why it's important, I'm heartened because it means that people understand that when somebody is not feeling well, it's difficult and it's hard to reach out for help. And so all the more reason that we have to reach out to the people we're worried about. Just a conversation. How are you doing? I noticed you've been sleeping a lot, or you've been drinking a lot, or I haven't seen you in a long time. It seems like, are you hiding? What's going on? And you don't start with, oh, are you thinking of killing yourself? You start with checking in and letting the person know what you see. But asking about it is really important too. Do you have anything to add to that?
Of course. I'm so glad you brought that up, because that's something that really stood out to me. Because when we go back to the 95% say, I would do something to help someone in my life. And I think then recognizing, that over half are like, well, they wouldn't reach out for help because of those internal barriers of feeling hopeless. And that is something that we do find in individuals who are experiencing thoughts of suicide, is feeling self-dismissive, you lose that ability to advocate for yourself. And so one thing is just reach out and start that conversation, that if this is a significant barrier, that they may know they need help, but feel like maybe there's something about them that maybe they don't deserve help, or that help won't be there for them, that it would be, just feeling in despair. And so making sure that we're asking and starting those conversations. And it can be just as easy as what you mentioned, of like, hey, I've been missing you. I haven't seen you. I've noticed these changes. Can we talk about it? Is one of the most effective ways and easy to start that conversation, to let them know, hey, I see you. I noticed that things are different and I want to talk about it.
Yes, like you matter.
You matter. Like, I notice you. And so that, I think, is one of the easy things, I think, for both of us, of working in the field of suicide prevention. And people go, well, what can I do? Or people saying, I'm scared that I might say the wrong thing, that I notice differences. I'm worried about someone. And, I'm interested in your comments, but for me, I would say, well, the only wrong thing is to not say anything. That it can be, and to be yourself and just say, hey, I'm noticing these differences. And I'm concerned, I'm worried, or like, I'm noticing changes and I care about you. Tell me a little bit about what's going on.
Yeah. And you don't have to become you don't have to become a therapist. The idea is to maybe help someone get to a therapist. And also, we're all working really hard at training up therapists so that they know what to do to help somebody, because there are some very specific ways in which you can help someone in terms of their mental health, or if they're thinking about suicide. But it's just no judgment. Just, wow, that's hard. That's hard. What can I do to help? Because you can't solve it in a conversation. But, research, like to what you're saying, research shows that not only can you say really harm someone, but asking about it actually can bring relief. Because, think about when you have something built up inside and you can't tell anybody and it's a secret and it gets bigger. And then, the way the brain is working when someone is not feeling well is it sees the world through that. That's why people see nothing is going to change, because their thinking isn't as flexible. They can't say, well, if I do this or if I do that, I'm going to feel better. They get to a point where they just feel nothing's going to change. And so it's incumbent on us to have those conversations. Now, we talked a lot about a lot of the questions that we have here. So what do? You have that conversation. What do you do to help somebody?
So, I think on that of you ask them first, just let them know that you care and that you're there for them. Was that just can't stress enough. I know that some people go, well, no, it seems like, but that's the first step. And sometimes the most important is just like, hey, I notice you, I see you, I care. I want to be here for you.
Mm-hmm.
And making sure that they know. And then, I know that I've sat with individuals in my life. I'm a mom of 3 sons. And I think, with a couple of them at different times of sitting, pulling out my phone and going, like, let's text 988 together, or let's text the crisis text line together. One, because they can help us through this conversation, or it also helps them to know what it's going to be like. And so trying to help walk them through, and then that way I know as a mom that they know how to reach out for help, because sometimes I think it can be intimidating. You're like, I don't know what would happen if I called this number, or if I texted, what would happen? And when you're having the worst day of your life it's hard enough to ask for help. And so I think on that of anyone to kind of walk them through and go, hey, I just learned about this new number. Let's call it together and just see what happens. Or let's text it together and see what happens. And then, hey, why don't you go ahead and save that in your phone, so that I know that you've got it just in case you need it.
And also you can always come to our website, afsp.org, I think it's /finding help. And we have tons of resources, general resources for specific communities, ethnic and racial communities. And it's not easy getting help because it's hard to find a therapist or a psychiatrist, but it does help, like you said, if you have somebody helping you. And that's something that a friend or family person can do.
I think also if we can, when someone does disclose, go ahead. Our survey told us that a lot of people think that it's courageous, that it's brave. And I would say just acknowledge that if someone's like, hey, I am really struggling today, like, I'm not sure how I'm going to make it, be like, wow, that took a lot of courage to tell me. I'm so glad that you felt safe enough with me that you could tell me, I want to be there for you.
Right. And you can even say, I don't know exactly what we're going to do, but we'll do it together. And I know there are ways for you to feel better. So let's just try together to make that happen. There is a question about the role of substance use in suicide. And it's a really big issue. And it's very hard to get help for drug and alcohol abuse when you're also not feeling mentally well, or you have mental health conditions of other kinds, and it's hard to get help. But also sometimes the substance can mask whatever other underlying mental health issues are going on. So to address that, I think it's really important to pay attention to substance use, someone using more than usual, because people don't start using substances to have a problem with it. They start to feel better, but inevitably, if the people use it regularly and they can't stop, eventually they're not going to feel better. They're going to feel worse. And for instance, alcohol, about 30% of people who die by suicide have intoxicated levels of alcohol in their blood at the time of their death. And about 25 actually have an alcohol use disorder. So if, substance use can mask other things that are going on, in addition, you have to get on top of that in order to treat the other conditions. And it's hard and it takes a lot of support, but there are treatments and more ways to help somebody with that. And to try and have those conversations, even if somebody is struggling with drugs or alcohol. I want to mention a couple of things that I found really interesting from the survey. One thing I thought was really interesting is that people, we added 2 new questions. Well, a couple more than that, but we asked about people's understanding of access to lethal means and suicide. And it turns out that more than half of people don't know that if you limit access to lethal means, things like guns and medications, you can actually prevent a suicide. Because in that moment, a person may not, if they can't get access, a lot of times it's impulsive. A huge proportion of people who engage in actual behavior, it happens in 10 minutes. So if you don't have a lethal means available, then that moment may pass. Time de-escalates and calms things down, and it also gives time for somebody to intervene. And even if they do try to take their life, they'll use something that's probably not lethal. And so on all counts, limiting access to lethal means is really important. And surprisingly, most people don't realize that more than half of suicide deaths are with guns. Because people don't buy them for that reason. But the fact is that whether it's the person who owns the gun, and many times it's a partner or a spouse, wife, or 80% of kids who die by suicide with a gun use a family member's gun. So it's not about being a gun owner. It's about protecting the people in your household from lethal means, especially since people don't always announce that they're feeling how they're feeling, or because it can be impulsive. The other questions, and maybe you want to talk about this, had to do with the role of both employers and also entertainment and media.
So, yes. And I think before roll on that, with the lethal means, I think there's a lot of opportunities for us to share more of education and public awareness, because I was struck. There's like, oh, we have a lot of opportunities to improve this awareness. And I'm hoping that we can see that changed, because although in the field that we know and have in many trainings that limiting access to lethal means at that moment, in crisis, can really be life-saving, that adding time, adding minutes to that saves lives. And so I think we can share that more, right? Because when I saw that, I was like, oh, not even 50% know that. And so I'm hoping that has me motivated for SPRC of what we can do to help. And, and it's everything, we're talking, it can be medications, firearms, other things, of making sure that someone who's struggling doesn't have access.
And that can be a conversation. It's not like you have to take it away from them. You can actually have conversations with people and do it together. So I know sometimes there's this feeling like, oh, they're going to take it away from me. But no, when you say, I care about you and this is what you're thinking of, and so let's create a safe environment so you can get through this difficult time. And then, then we won't have to worry about access. And I think that's particularly true with firearms. But and it's also, it takes work and effort to remember to secure your firearms and things like that. And people don't realize that the majority of gun deaths are suicide deaths. So it's not why people buy guns, and but it is why people can die from them. So something to be thinking about. Anything else you want to say on that before we move over to employers and entertainment, which is fun?
Yeah, I guess the only thing on that would be, knowing that a lot of people are purchasing firearms to protect their families, protect themselves and their families. And I think some of us have helping them do that in a safe way, they are not purchasing a gun to put their family in danger. It's the opposite. And so, I know that there's programs that AFSP has been involved with and others of really, having good education programs within firearm communities. And so would encourage folks, if they're curious and have more information, to look those up. I know that we've got some folks working magically behind the scenes. So if someone can drop a link to the firearm safety program that AFSP has and others. But yes,
Also,
I think, go ahead, and then I'm ready to dive into employers.
Okay, now I wanted to catch you before we moved on.
Yes.
Two really great resources. So we have Lethal Means Counseling, a great informational program for communities. Definitely go to afsp.org. But also there's a website, and it's not just for firearms, but for medications and other lethal means, called LOCK, LOCK, and then the number 2, LIVE. And it's a decision tree about, it asks you about what you have in your home that might be lethal, and then what you might do with it, and how realistic is each of those options to help you come up with a solution. The other thing is that there are actually gun storage places. In every state has gun storage places. And so you can literally Google gun storage places in Missouri or Colorado, and you'll get a map that can show you where you could temporarily remove them. So there's more and more resources because people are starting to understand. But again, like you said, less than half people understand the connection. So, but that's it's the most effective thing we have to save lives, by the way. Okay, so let's talk about employers.
So yes, so most Americans, I was surprised at how many thought, my employer has a role to play in mental health. And I'm not sure that it would have been the same, before, because I think after COVID, when the entire nation was talking about mental health and what we can do to keep everyone healthy, safe, and well in all aspects of their life, that now that is that expectation. And so, yes, so for employers and those of you knowing that, we know now, you spend more time with your coworkers and at work than oftentimes you spend with your families. And so making sure that it is a mentally, emotionally safe place to work, not just physical safety, but more and more employees see their mental well-being, that their employer plays a role in that.
Yeah, and so it was over 90% of people think employers should play a role. So many said in terms of benefits, but that's actually mandated at this point to have mental health benefits on par with physical health benefits, but also creating an environment where people can talk about their mental health, get treatment, and it's encouraged, not discouraged, where there's support for reducing substance use, and that everybody gets educated. This is in the poll. Most people think that people in the workplace should be educated. And we had the great opportunity to work with, to get, now I'm blocking on it, the OSHA has now included suicide prevention in their work, the mandatory posters at work, like the choking poster. Well, now there's one about mental health and suicide prevention that's required. So, but there's lots of ways in which an employer can play a role. Just opening the door, having mental health days, being mindful of the workloads, and when being flexible in that, when someone's having a difficulty. If you broke your foot, there'd be flexibility. You need that same flexibility if you're like experiencing a depression or whatever. So I thought that was very heartening, and the conversations are really opening up. We're working, for instance, with Bechtel in the construction industry, because they realize they have to address mental health and suicide prevention. It's the second leading cause of death. Second highest industry in terms of suicide rates. Let me rephrase that. In the country. So they're taking it on because we can. So more and more employers, we hope, will be, seeking what they can do to help prevent suicide. And guess what? 70% of people are saying that they're doing something to take care of their mental health. This is from the poll, and mostly they're eating well, they're trying to work on their sleep and get exercise. So those basics, they're not going to, they just help. It's not going to cure, a depressive episode, but it will make it better and not worse if you can take care of those things.
Right. And I think that it's important that, any steps that we take going, I want to be healthy, it matters, just like with anyone in our life, or if you've got a plant, just remembering to water it and talk to it. Taking those steps of just sometimes just getting up and putting on clean clothes or bathing. Yep. You're doing things that are taking steps towards taking care of your mental health, and it will help you feel better, or no, it's not going to cure anything. But those steps and all of the little steps in that direction help reinforce good, healthy lifestyles, and also reinforces that you're worth it, that you deserve to be taken care of. And sometimes doing those little acts of self-care can be life-changing.
Yeah. Sometimes it's as much as taking a shower, like you said. But in the poll that we did, these are the things that people are reporting that they're understanding. And I can tell you from being in this field for, I won't say how many years, a gazillion years, none of this would have been discussed. I started in 1985 in this field, and they thought, oh, you can't even say the word suicide. And now we know you can help somebody to, just by saying, are you thinking of suicide? So we've come a long way. We have a long way to go. We have a question here about.
I love that the construction industry is taking the lead in addressing this, because, when we think of construction workers and things, we think, manly and tough, and mental well-being is important. And I love that they're addressing that, where, and hopefully, all other, workplace, will take that. All industries need to value that mental well-being of their employees. But I do love seeing the construction industry, really stepping up to take care of their own.
Yeah. And when we start having these conversations and taking care of people, it works its way out. It's just like people are as they said, they're more likely and more comfortable talking about mental health and their own mental health than they were in the previous surveys. I mean, that's been increasing. Every time we do the survey, people are getting more and more comfortable about their reporting, that they feel more comfort talking about their own mental health and suicide. And I think that's very promising, only because we talk about our physical health all the time, right? And we learn from each other. Oh, you have that? I had that, and I did this, and it helped me, So we want to be able to have those same conversations about mental health. We do have a question about what can a family do about postvention? And, I think we can just touch on that. It's not the topic, but I think what postvention is after a suicide, because when there's a suicide, according to Dr. Searle, it impacts, on average, 135 people. It has a big impact. And so how do we deal with that when somebody dies by suicide in the safest and most caring way? And there are things you can do. Do you want to say a word about that?
Sure. I'll say a little bit, and then I'm confident that you've got probably some solid what the research says. Sure. But I would say, just as someone, from an impacted family and who's lost individuals to suicide, is to be patient. I think oftentimes we want to be better, and we want our loved ones to be better, and to be patient with that grief process. Be understanding that everyone is going to grieve differently. And so I would say, one, just on that human level of being compassionate and understanding. I know that there's some guidelines that we have in an after suicide toolkit for schools, for things of, knowing and prepare for those anniversaries. And I don't know, Jill, I would let you talk about, there is a guide that AFSP worked with the Dougie Center on
Yeah.
working with children and teens for families following a suicide. So I don't know if there's some extra tips from that you want to share.
Yeah. So, and you can also at afsp.org, we have a section called I've Lost Someone to Suicide. And so there's lots of information when there's a loss, there's the family or closest friends and how they experience it. And then there's the larger public. And then there's things like places like workplaces. And I think that, like you said, Shelby, it's a process, and it's not a linear process. It's not like better and better and better and better. No, it's like better, good day, bad day, horrible day, great day, and it is a process. And, I was thinking 4 words that I find helpful, which are compassion, respect, patience, and persistence. And I think after a suicide, it's important to have that with yourself and also with your community, because people don't necessarily know what to say. And part of what we're trying to teach people is say something. There's no right answer. What are you going to say? Somebody lost somebody. There's never a right answer except I'm here. I'm sorry. I feel for you. Here's my shoulder. You can cry on at any time. Do you need food? Don't even ask. Just bring over dinner, anything to just be present. Sometimes it's just sitting on the couch with somebody. But it's important for the larger community, like through media, to focus on how the person lived. And you will get to that if you've lost somebody to suicide. At the beginning, it can be very traumatizing, and you focus on how they died. And then, of course, people want to know, well, what happened? And you don't have to tell them what happened, because repeating methods is not really helpful to anyone. It doesn't provide them anything unless you feel better getting to say it. You don't have to hide it, but you don't have to say what happened either. Now, if you're grieving for, there's no limitation on grief and bereavement, and it takes a while, and it's not something you recover from or get over. But what does happen is you have that pain of loss, a hole in your life, maybe trauma, maybe anger, maybe, so many feelings that people could feel. And that's where support groups are very helpful, because it means you're with somebody who you don't have the same experience, but you have some underlying understanding. We also have the International Survivors of Suicide Loss Day. It's the Saturday before Thanksgiving. We have a Dia de Esperanza on the Friday before for the Latine population. And we have International Survivors of Suicide Loss Day from a Jewish lens on that Sunday. And these are programs to bring people together to process the loss and process living, because, even when we have a loss, we're still living. But if you find that you can't get back to life, that you just can't go out of your house, you're focused on that person and the loss, and you can't enjoy anything else in life, and you're really, really stuck, we call that prolonged grief. And there's really helpful treatments for that. And you can come to our website and see that. There's the Columbia Prolonged Grief Center trains people in how to do it. Very effective. So you're not alone. But also in a family, people grieve differently. People want to talk about it, don't want to talk about it. And so you don't have to just grieve within your family. There are support groups. Come to our walks. It's not that people are we have walks. We have about 450 walks around the country, and they serve a lot of purposes. They put a face on suicide prevention so people understand you're not alone, that there are things we can do. It also helps us to raise funds for the research. For instance, this year we're funding 34 new studies for $7.5 million. And everything we know about suicide has come from research. So many people find when they're ready to get involved in suicide prevention work, and we're here for that as well. And there's a lot of work going on for people with lived experience. So more and more research is including people with lived experience. I know, Shelby, in your work, we're including people with lived experience. So you can turn that pain into something that feels better. And but you're not going to forget your loved one. That's the other thing. People think, oh, if I laugh and have fun, that means I'm forgetting the person. And no, you're not forgetting the person. In fact, you're potentially, you can be paying respect to the person by getting back to life. But, it's a complicated thing. And there are some great books on our website about grief. It takes time. I'm going to shift gears here now to entertainment, because there's been a lot of talk about media and entertainment, and like, what role does entertainment play in suicide prevention? I don't know if you want to say a word about that, Shelby, and I'll follow up. Or
Yes, I mean, suicide and mental health issues have been part of entertainment, since Shakespeare, since the Greek tragedies. So, it has always been something that's been part of entertainment. But I think now people are becoming as kind of more sophisticated consumers of that media, and they're wanting to see more healthy stories. They want to see, what does healthy help-seeking behavior look like? What does healthy help-giving behavior look like? And so individuals wanting media and seeing media has a role to play in, what does that process look like? And I think, there have been some good examples that have come out, but they want to know, and they feel that media has a role. And so I think of that, of being responsible. There are websites and toolkits that both my organization and yours have worked hard to work on safe messaging. There's a safe messaging toolkit for media that talks about safe storytelling. There are tools on safe messaging for reporters, but one of knowing people expect, when they're seeing this in a plot line, that it's handled responsibly. And I think it's about time that it is, that they're like, hey, because, back in the day, my family of that, characters had cancer or had other things, that it was handled as if it was, more of a stigma and drama. And I think we're expecting a fuller story. We've seen since the 90s and the 80s of characters with cancers recovering and getting better. And I think now is a time with individuals with mental health to see them getting better, see them working with their friends, their family, their mental health care providers and healthcare providers as they're on that journey of wellness. And so I think, it is time, for more robust stories. And there's just so many good people in the field and in the entertainment industry that are coming and getting involved with the suicide prevention community because they want to do a good job telling those stories.
Yeah, I mean, it's great when they put 988 and they let people know. Some people say, why are there trigger warnings? Well, that's there because we know that if you're actually showing methods and people actually engaged in suicidal behavior, it can be very traumatic for people who've lost someone or had their own personal experience. And you don't have to put yourself in that position. And at least you can know, oh, this is something that's probably not healthy for me. We just had a webinar a couple of hours ago on contagion and also on the positive impact that media can have. And it really, like, the fact that people think media can help, well, the research shows absolutely stories of hope, stories of recovery, not fake, oh, sugar stories, but like, this is hard, but it happens and you can feel better and life is worth living, but you have to play a role in that. That actually can save lives on the population level. But like you said, Shelby, there aren't enough stories about that. So we as an audience can encourage and I'm one of these people, I write to the, when I see something that's over, I write to the media and say, hey, could you not do that again? It's really dangerous, or there's another way to do it. So we can play an active role in that. I mean, that's the point, is that we can play an active role. Somebody just asked a question about where the money goes to. And, Shelby and I both work at organizations where the money goes to suicide prevention. It goes to pay people to do that. I get paid, Shelby gets paid, but we are not we're not those big executives that are getting all that money, and nobody in suicide prevention is. So I can tell you at AFSP, 80% of the money goes to programs, research, advocacy, and support for people who have been affected by suicide, whether it's very specific community programs, funding research. I mentioned we're funding $7.5 million in new research. We have advocacy office in Washington, D.C., and we have advocacy days in all 50 states, and we're really volunteer-based. And Shelby, I think, the work you're doing is so critical for so many. And I don't know if you want to say a word about it. We don't want to spend too much time on this, but please know that this is a labor of, I want to say love, but import. We're on a mission, all of us. This is a tough thing to do, but we really believe in it.
It is, and with our project, the Suicide Prevention Resource Center is funded by SAMHSA, which is the division of Department of Health and Human Services. So it is everyone's tax dollars at work. All of our resources and materials on our website are available free of charge. And I think, when you look at the investment that happens both through the federal government and in the nonprofit sector, suicide prevention is still very low on the list. And I think of looking of the money, doing when I used to be a statewide coordinator, trying to do a statewide training effort for school teachers and school counselors, it gets very, very expensive. And when we look at the money of the dollars that are available, yes, we all need to be good stewards of our money, and knowing, with ours, if we answer back to the federal government and are always trying to do more with less, because we know that the nation's counting on us. And I know from my time at AFSP, I started off as a chapter volunteer, I think 2009, 2008, 2009, as a chapter volunteer. And then when I had the opportunity to come work at the national office in New York, and was shocked that this national organization that seems so big on the outside, of getting there and seeing just how small the corporate office was, and how, trying to make sure that all of those dollars get back into the community.
We're really,
that there was more, because that I think that people would be surprised that with AFSP at how little of the funds stays for the overhead. AFSP has a very low overhead.
Yeah, we're kind of stingy that way. So it's hard to prove that you've prevented something, but I always think of it as one person, one life at a time, and this is the hardest. This bunch of people that we all are in this field across the board. It's a very small field, so we kind of all know each other. I think get it.
We do get it, and but there's hope with 988. When the bill was passed for 988, the federal government invested more, and states have been investing in it, and others where 5 years ago, 10 years ago, there was very little federal investment or state investment into crisis services. And I know that AFSP and other organizations really worked hard to make sure that there were federal dollars for that infrastructure. And now here we are in 2024, and it's there. There are millions and millions of dollars now that are available for crisis services, and it's made a difference right away.
It's working.
The capacity building has worked, and the ability. And so I am optimistic of seeing that change so quickly, that in suicide prevention, of increasing the investment, that these are lives that can be saved. These are lives worth saving. and definitely worth the investment. So I am optimistic within the next 5 to 10 years, that we may see a much larger outpouring, the dollars going towards suicide prevention. I would love for it to be close to the dollars that go out for motor vehicle safety, that go for um, other things that are in fact, affecting the population.
Well, this brings us back to the poll because we only have a couple of minutes left. And the idea that what do people think is going to change the trajectory? And one is educating clinicians and health clinicians, mental health clinicians, primary care clinicians, first and foremost. Educating the public to be able to identify when somebody may be struggling, regardless of whether they're suicidal or not, that they might need help. Helping helps. And also developing problem-solving skills and social emotional skills. They want there to be more research. They want media to be responsive and respectful in their reporting. And these are things that we can all push for. So, Shelby, I'm going to give you a second to maybe some final thoughts before we close out here.
I would, encourage folks, speaking of that, with training and education, please visit sprc.org. We have a national clearinghouse, resources. If you can't find what you're looking for, there's a contact us. We will either point you in the right direction or point you to the organization that we feel has that information that you need. Also, the National Action Alliance for Suicide Prevention, the strong partner with both of our organizations. There's some good resources and toolkits on their website. So one, education is the need. And the good news on that is I would assure that we're all working creatively to try to come up with good training solutions that anyone can access 24 hours a day. So I know on our website, we've got a lot of webinars that are available, and we've got some great interactive online self-paced courses. So I'd encourage everyone to check those out. They're free of charge. And I know that you all have good resources on your website that anyone can access.
That's right. So one thing you can do is learn. Use all the resources that we have to learn, to connect, and to elevate the task of preventing suicide. So I'm so glad we did this poll again, because clearly people's perceptions are getting more and more positive about suicide prevention, about having conversations, about reaching out to other people, but also some of the things that we need to do, like getting everybody up to speed on education, improving access to care. And we hope that you will all work with us and help us to do the best we can to prevent suicide. So thank you all for coming, and we appreciate you.